Modern medicine has achieved staggering success in doing one specific thing: keeping us alive into critical moments after acute trauma. When a heart stops or an artery bursts, emergency teams and trauma surgeons work with a speed and efficacy that borders on the miraculous. To execute these life-saving interventions, we rely on highly specialized tools. We use advanced robotic surgical systems, intensive care units, and rapid molecular diagnostics to repair physical damage instantly. But conditions like obesity, type 2 diabetes, and depression do not behave like sudden trauma. They are chronic diseases, conditions that evolve gradually over decades through a complex web of genetics, daily lifestyle choices, stress, and environmental factors. Our hospital systems are built to treat short-term, isolated episodes of disease. They are entirely the wrong environment for managing conditions that require continuous behavioral and metabolic support. This creates a logistical nightmare for frontline physicians. Traditional medicine organizes itself into organ-specific silos. A patient with metabolic syndrome might see an endocrinologist for their hormones, a cardiologist for heart disease, and a psychiatrist for anxiety. The patient bounces between distinct, isolated departments, receiving overlapping tests and competing treatments. An infrastructure engineered to fix single broken parts simply cannot heal a human body that functions as a deeply interconnected biological network. Treating chronic illness with an acute care framework is also financially devastating. In the United States alone, healthcare expenditures have reached $4.1 trillion annually. The vast majority of this capital is consumed by recurring hospital visits for conditions that originate and could be actively managed in the community. Because doctors lack the time and infrastructure to address the root causes of these conditions, they turn to pharmaceutical interventions. While these medications manage superficial symptoms, they frequently introduce compounding side effects, requiring even more drugs and creating an expensive, lifelong dependency loop. Patients are recognizing this failure. Recent studies show that up to 92% of people managing chronic diseases now actively prefer physicians who incorporate complementary and alternative medicine. They want treatments that acknowledge their complete physical, mental, and emotional reality, rather than addressing only their immediate symptoms. Facing a rapidly escalating financial burden and a clear mandate from patients, healthcare providers are realizing that adding more hospital beds will not solve the problem. They have to redesign the delivery system itself. This redesign starts with a newer understanding of human health known as systems biology. This field proves that the body operates as a unified network, where the gut microbiome influences brain function, chronic psychological stress alters hormone production, and immune activity dictates metabolism. We also now understand the mechanics of epigenetic regulation. This is the process where external factors like daily nutrition, sleep patterns, and stress actually influence which of your genes are activated or suppressed. Your environment and behaviors physically alter your cellular activity over time. Because lifestyle directly alters biology, complementary and alternative medicine, often called CAM, is moving out of the margins. Practices like targeted nutrition, specialized breathing techniques, and yoga are no longer viewed as general wellness advice. They are recognized as specific, evidence-based biological interventions that regulate the nervous and immune systems. This chart illustrates the biological mechanisms triggered by different breathing exercises. Looking at Ujjayi, slow, controlled breathing increases baroreceptor sensitivity, the neural sensors detecting blood pressure changes. This directly improves heart rate variability, yielding measurable reductions in cardiovascular disease risk and stress. This table outlines clinical evidence for specific Ayurvedic medicines. For type 2 diabetes, fenugreek is utilized to improve insulin signaling and reduce carbohydrate absorption. Similarly, curcumin is used alongside conventional treatments for knee osteoarthritis to inhibit inflammatory mediators and reduce pain sensitization. Incorporating these therapies is not a step away from modern science. Given the complex nature of chronic disease, deploying comprehensive whole-person care is now a strict biological requirement. To properly deliver this type of care, medical professionals are changing where they practice. They are moving the focal point of chronic disease management away from expensive, high-stress hospital environments and directly into local neighborhoods. The solution taking shape is the Integrated Community Navigator model. Instead of waiting for a patient's prediabetes to escalate into full cardiovascular disease, a community navigator actively coordinates risk assessment, nutrition counseling, and stress reduction to catch and reverse those risk factors upstream. These navigators operate within community holistic treatment centers. A patient arriving at one of these centers experiences a single cohesive patient journey. They receive standard GP care and modern diagnostics while simultaneously accessing yoga therapy, acupuncture, and nutritional counseling, completely bypassing the central hospital system. By housing these disciplines under one roof, a multidisciplinary team can address a patient's health concurrently. While a physician monitors blood markers, a behavioral coach and a yoga therapist work to lower the patient's systemic inflammation and autonomic stress, treating the underlying causes of the illness all at once. Physically migrating this care into the community transforms the healthcare model. It stops being a reactive disease repair factory and becomes a proactive health creation system. The economic data supports this shift. Preventative, community-based interventions cost a fraction of acute hospital admissions. This economic model visualizes the financial impact of a structured community yoga program. An initial investment of £220 per participant generates an estimated net annual saving of £9.7 million. That translates to a return on investment of 4-to-1, generated by reducing GP consultations and preventing expensive emergency admissions. With national healthcare budgets breaking under severe strain, relying solely on highly technical hospital treatments for chronic conditions guarantees financial ruin. Integrating complementary therapies with conventional care provides the only mathematically viable path forward. Investing in holistic, preventative care is no longer a fringe idea or an alternative luxury. It is a mandatory structural necessity to sustain population health. Integrated healthcare represents the next logical step in our medical evolution. It seamlessly combines ancient, evidence-based practices like Ayurveda and mindfulness with the cutting-edge capabilities of artificial intelligence, precision genomics, and wearable health technology. For physicians, this is a profound professional shift. It allows them to step out of fragmented assembly lines and return to the historical mission of their profession, deeply understanding and actually healing the patient in front of them. Because biological data can only tell part of the story. To truly treat a disease, a health system must understand the values, the daily environment, and the psychology of the whole human being hosting it. The ultimate goal of modern healthcare is evolving. We are moving past simply managing illness to building a framework that equips every individual with the integrated tools they need to achieve lifelong health